we're going to be moving on to the upper extremities part of the comprehensive assessment. Upon first inspection of the patient, shoulders are symmetrical. Patient doesn't seem to be leaning more side to the other. No deformities are noted within the patient's shoulders, arms, or hands. Patient's skin tone appears appropriate for ethnicity. No obvious sores, masses, lesions, cuts, and hair is evenly distributed along the arms. I'm going to palpate for any type of tenderness or pain. Any pain upon palpation? All right, and no deformities noted as well, and also no change in temperature during palpation either. All right, we're going to move on to palpating the brachial pulses. All right, pulses are +2 bilaterally. We're also going to assess the radial pulses. +2 bilaterally as well. We're also going to assess skin turgor of the hand. All right, elasticity of the skin relaxes after less than 2 seconds. Also going to assess cap refill of the nails. I'm going to check on the other hand as well. All right, cap refill returns less than 2 seconds. Also, the nail beds appear pink, no signs of cyanosis or clubbing as well. We're also going to go over a range of motion. I'm going to have you wiggle your fingers. All right, have you roll your wrists. Okay, have you put your arms up like this and go up and down. All right, we're going to do the windmill action. Have you do this. All righty, I'm going to have you squeeze my hands. All right, I'm going to pull your arms, try to resist. All right, I'm going to push towards you, resist. All right, have you put your arms up like this and resist when I push against you. Okay, range of motion and strength is intact. Next, we're going to move on to the chest area. Upon inspection, patient respirations are even and unlabored. Patient posture is upright. No signs of slouching as the patient readjusts to sit up even straighter while we're showing off there. All right, we're going to assess for tactile fremitus. When I place my hands on your chest, I'm going to have you say 99.
99.
Okay.
99.
All right.
99.
Alrighty, and next we're going to assess the cardiac sounds. We are going to assess at the aortic, pulmonic, Erb's point, and then also the apical as well. Alright, S1 and S2 are heard. No signs of murmurs or any other extra heartbeats. Next, we're going to assess respirations. We're going to assess at the bronchial, the bronchovesicular, and the vesicular points. No adventitious breath sounds heard. Breath sounds are clear bilaterally. All right, next we're going to assess the back. So I'm going to have you kind of come around on the other side of the stretcher so we'll be able to see the back side. There you go. All right, perfect. All right, from first glance, patient respirations are even and unlabored. No signs of retractions. The depth appears to be even as well. So we're going to do tactile fremitus on the back of the patient. So every time I press down, I have you say 99.
99. 99. 99.
All right. And then we're also going to listen to breath sounds as well at the same points as earlier at the bronchial, the bronchovesicular, and also the vesicular. next we're gonna move on to the abdominal. I'm gonna have you lay back. Have you lay flat. I was gonna have you lift up your shirt so we can see the abdominal area. All right, upon first inspection, it appears that the abdominal area is flat, no signs of distension, any roundness or any sunkenness, no signs of masses or lesions, no obvious redness or swelling. Patient does have a few little freckles and a little bit of hair around the umbilicus area. And next we're gonna move on to auscultation of all 4 quadrants. Bell sounds heard in all 4 quadrants and definitely active, that's for sure. All right, next we're going to move on to light palpation. All right, let me know if you feel any type of tenderness. Any tenderness felt? All right. During light palpation, no masses and no hernias felt. All right, I'm going to have you sit on up there. All right, you can cover your belly back up. There we go. All right, next we're going to move on to fine motor. I'm going to have you follow what I'm doing. Have your fingers touch your thumbs. All right, repeat. All right, I'm going to have you put your hands on your thighs and flip over. All right. Next we're going to move on to the deep tendon reflexes. First, we're going to do the patellar. All right. Okay, and next we're going to do the dorsal. I'm going to put some gloves on for this. If I can actually get these on. All right. And like I said, we're going to test the dorsal or the Achilles area. There you go. All right. Okay, and patient acted appropriate to both reflexes. And lastly, we're going to do the plantar reflex. Sorry, it does tickle just a little bit. We're going to do the next foot as well. All right, and patient did act appropriately. Toes did curl at the end. Oh, and another thing I did for you to do earlier, I'm going to have you lay back down. I apologize. We're going to assess the legs and the feet. Upon inspection of the legs, there's no muscle wasting or atrophy noted, no swelling, no redness, no obvious bruising or lesions noted. We're going to palpate as well. And no obvious deformities noted. We're going to assess the femoral arteries on both sides. All right, +2 bilaterally. Next, we're going to assess the popliteal. And sometimes these are a little bit harder to find. All right, and +2 bilaterally. Gonna next move on to the posterior tibial. +2 on that side. And also +2 on that side as well. I'm gonna go ahead and take your socks off for just a second. I'll put them back on before I have you stand up on the floor. All right, we're going to assess the dorsalis pedis pulse. +2. +2 on that side as well. All right, we're also going to, in the feet, no signs of swelling or redness, A little bit of bruising on this one great toe right there. Looked like he might have dropped something or kicked something with it. Hair evenly distributed, a little bit of hair noticed on the feet, and no obvious deformities felt. All right, we're going to assess your range of motion. I'm going to have you lift up this leg, knee to chest. All right, kick out. All right, I'm going to have you do the same thing with this leg. And kick out. There you go. All right, I'm going to have you kind of do like a scissor with your legs. Okay. All right, I'm going to have you press against my feet. I'm going to press against yours, resist. All right. Range of motion and strengths are intact. Put your socks back on there. Oh. Please don't kick me, sir. All right, there we go. All right, I'm going to have you sit back up. All right, now I'm going to have you stand up. Have you back towards me. All right. No obvious curvature noticed within the spine. Patient appears to be standing up straight. All right, I'm going to have you kind of bend over, start to touch your toes. You're going to check for scoliosis. All right. No obvious curvature in the spine. Spine appears to be straight. I'm going to have you stand back up. All right, I'm going to have you twist to one side and twist to the other side. Okay, I'm going to have you kind of hyperflex back where you lean back. Okay, and then I'm going to have you go from one side to the other. All right, range of motion appears to be intact within the spine. Now I'm going to assess your gait. I'm going to have you walk from one end of the room to the other. All right, walk back towards me. All right, now I'm going to have you walk heel to toe. All right. Patient appears to be walking appropriately, and this is the end of our comprehensive exam. All right, and we're going to scan the room so you can see that there is nothing up there. There's nothing outside, just the patient. And that's just my backpack. Nothing written on the board or on the door or even on the ceiling as well.